to the Swiss Liver Patients Association, Swiss HEPA. Today with the presentation by PD Dr. Christoph Jüngst, Senior Physician at the Clinic for Gastroenterology and Hepatology at the University Hospital Zurich, with the topic Herbal and Dietary Supplements Induced Liver Injury. Welcome, Dr. Jüngst.
Hello, Mrs. Bobson. Thank you very much for your kind invitation to give a talk on herbal and dietary supplements induced liver injury. Herbal and dietary supplements are very popular. In Europe, up to 20% of the inhabitants of the population take herbal and dietary supplements, and in the US, up to 60%. They are often taken as lifestyle products for revitalization, for weight reduction, or as antidepressives. They are less regulated than drugs, and their efficacy and their safety does not have to be proven. They can easily be traced also via the internet. The patient feels safe because they think herbals that can't cause any injury, and they are taken most often without knowledge of the caretaking physician. The mechanism of liver toxicity is often not known. There's a wide range of clinical presentation. We can have patients with only mildly or moderately elevated liver enzymes. However, liver injury can progress even to acute liver failure. The incidence of liver injury is low, but it was rising in the recent years. On the right side, you see a graphic of patients with herbal and dietary supplements induced liver injury from a registry study. In the years 2004 to 2005, only 7% of all drug-induced liver injuries were because of herbal and dietary supplements. In the years 2013 to 14, already 20% were because of herbal and dietary supplements. And in China, the most important cause of acute liver failure is acute liver failure due to herbal and dietary supplements. Herbal and dietary supplements are in more than 100 substances, and the most important ones are anabolics, green tea extracts, and multi-ingredient dietary supplements. The most important cause why people take these supplements are bodybuilding, depression, and weight loss. Taking the history is very important to get the diagnosis of liver injury by herbal and dietary supplements. This can be very challenging. Patients often don't report herbals because they don't think that this is really important, that they can cause any injury. The diagnosis is only to be made when other chronic liver diseases have been excluded, such as viral hepatitis, autoimmune hepatitis, or biliary tract diseases. Therefore, we have to do a lot of lab works, taking autoantibodies or a viral serology, or do liver ultrasound, or even do liver biopsy. The clinical cause is most often viral or most often acute hepatitis. We find elevated transaminases, and cholestatic cause is less often seen. The latency is in most cases 1 to 6 months. It is important to prove causality, and this is really difficult. We need to do a literature research, and there is an important website. It's called LiverTox from the American NIH, and it gives a lot of information on drugs, but also on herbal and dietary supplements which can cause liver injury. Next, I want to show some of the most important herbal and dietary supplements which can cause liver injury, and I want to start with the green tea extracts. Green tea extracts from Camellia sinensis, they are said to induce fat burning, they're used for weight reduction, they should improve general health. They are part of more than 100 dietary supplements, but their efficacy is really not clearly shown in human studies. They don't have any license for specific indications, and they are not regulated. Liver injury by green tea extracts is rare. However, there are more than 50 case reports which really showed severe liver injury, progression to acute liver failure is possible, jaundice, even fatal cases have been shown. Hepatitis most often starts 1 to 6 months after the intake of the green tea extract, and most likely it's idiosyncratic DD. There has been shown an association with an HLA variant, which also points to idiosyncratic DD. It's important to distinguish green tea extract from the regular normal green tea. This regular green tea does not cause any injury for the liver. You can really take your green tea, this is not a problem, but stay off from the green tea extracts. Next, I want to show you the dietary supplements used for weight reduction. They are no drugs. They can easily be purchased, for example, via the internet. Some substances are named hydroxycut, oxyelite pro, lipokinetics, and in these substances you find a lot of different ingredients, and it's really hard to show which of these ones is the one causing liver injury. But for these three, there was shown that they can cause acute hepatitis, and even severe cases with liver failure and fatal cases occurred. Therefore, these substances had to be taken off the market, but there are still other substances on the market which can easily be purchased. Next, I show you some selection of herbals which can cause liver injury. One of these are the pyrrolizidine alkaloids. They are part of more than 6,000 plants, and they have been shown to cause the sinusoidal obstruction syndrome, where thrombosis of the small veins in the liver occurs, leading to portal hypertension and the complication such as ascites or varices. There are other herbals like germander, greater celandine, kava kava, black cohosh, which have been shown to cause hepatitis. And the greater celandine is interestingly part of Iberogast, a preparation which is often given to patients which complain dyspepsia. And in January 2018, there was a letter of alert from the Swissmedic, which reported that Iberogast can cause severe hepatitis. Also, traditional Chinese medicine, which comprises more than 30,000 different herbal mixtures, can cause liver injury. There are different toxic classes, for example, the pyrrolizidine alkaloids, where we have already heard about. Anabolics are a well-known cause of liver injury, mostly synthetic testosterone derivatives, often illegally mixed with the preparation, and which are often not labeled on the compound label at all. They're used for bodybuilding by young men and most often used without any control by a physician. There's a typical clinical cause with jaundice and itching, which starts 1 to 6 months after starting the preparation. The clinical course can be quite prolonged with a jaundice of more than 2 to 4 months, and patient may eventually also develop kidney injury. When the patient gets biopsied, the histopathology most often shows a bland cholestasis. The therapy is easy, stop the antibiotic, treat itching symptomatically, and in most cases the liver regenerates and we find the restitutio ad integrum. Only in rare cases, the follow-up shows liver adenoma and hepatocellular carcinoma. There are many difficulties to prove liver toxicity by herbal and dietary supplements. First of all, like with drug-induced liver injury, other liver diseases have to be excluded. There has to be a lot of lab work done. The other thing is that patients often don't report the intake of herbal and dietary supplements because they think herbals are safe, they don't cause any injury. Often these substances are multi-ingredient substances. We have a lot of essentially other herbals which are mixed in there, or the patient is taking also additional substances or herbals or drugs. The processing might be inadequate, which then leads to a potentially toxic substance. Possibly the selection of the plant was incorrect, or the selection of the part of the plant. The storage was inadequate, or the processing was inadequate. Also, there might be a contamination of the substance with toxins. For example, heavy metal, pesticides, plant poisons, microorganisms, or other drugs. Finally, the ingredients may not be labeled or labeled wrong, so we don't really know what is in this substance. In conclusion, the intake of herbal and dietary supplements is very popular. Liver disease by herbal and dietary supplements is rare, but they are increasing. The most important substances are anabolics, green tea extracts, and dietary supplements used for weight reduction. It is important to exclude other liver diseases before we can really get a clear diagnosis. And the patient history is very important. There are some difficulties proving the causality with a specific substance. In the case of anabolic intake, we have a typical clinical cause with prolonged cholestasis. In most of the other substances, we find an unspecific hepatitis. The therapy is simple. Stop the preparation, don't use it again. And in the rare cases, when we have really a progressive disease to acute liver failure, liver transplantation is the final option. And the side effects and liver toxicity have to be reported to Swissmedic. Thank you very much for your attention.
Thank you very much for the informative and exciting presentation by Dr. Jüngst and your great personal commitment. Thank you very much.